it's really cool to be here. Hello, everyone. I can see you in this really cool camera, which is awesome. Hybrid events, they're fun. We're super excited to be here for lots of reasons. One, to tell the story of Alydia Health, originally called InPress Technologies. So when you hear the three of us switching back and forth between InPress and Alydia, that just is what it is. We call it both. So don't be confused. And yeah, so I guess we'll start with just some quick introductions of the three of us. So a little bit about me as a person. I grew up in Sacramento, and my first business was actually breeding and selling pigs to 4-H kids, which was awesome. And I actually made enough money to buy my first car. So very different than a medical device, but that's how I kind of got my entrepreneurial start. I'm a Cal Poly alum. I studied business and I got a stats and a Spanish minor, which gave me an opportunity to study abroad, which was awesome. I was one of the students that started the Cal Poly Entrepreneurs, gosh, over 10 years ago now. So really cool to see the club still going really strong and having such an impact on campus. Really awesome. A big change from like our first meeting of about, I don't know, 8 people. Also, while I was a student on campus, I helped run Innovation Quest, which is actually where I met InPress for the first time, the concept for the device. And I was lucky enough after I graduated to work at the Cal Poly Center for Innovation and Entrepreneurship for a while, and I got to run the first accelerator program, which helped me kind of start InPress with my great team and also make a little bit of money at the same time until we were ready to go full time. All right, Amy, do you want to go ahead?
Sure. I'm Amy, or Amelia, whatever floats your boat. I didn't actually look at my slide after I wrote it. So I grew up in Merck, California, and what did I write? Okay, cool. I read it. But I went. I grew up in Berkeley. I went to UC Berkeley for undergrad. Did a bunch of things. Decided really wanted to go back to grad school to understand like how we can make devices that treat problems better. I think engineers and doctors, they have to do good things, and we come together in this really undesirable, underwhelming ways. Sort of like, how can we make this better? And we're both working in a hospital and understanding engineering. I felt like maybe I can speak both languages. So Cal Poly, grad school, that was pretty fun. And I got my master's degree here, and I studied hemorrhage control, and then I didn't get a job. So then I worked at a coffee shop, which was great. That's where I met Max, which was a friend who worked at the hot house, and he was like, "You should meet Nathan and Jessie." So that was sort of how I met them, which was pretty fun. I did. Yeah, my first invention was a Nerf torpedo that was leashed because it goes really far. That I like to make things out of garbage or trash, or I like to think of them as discarded goods. I still make things like that, but not Nerf guns anymore. No, but upon the right request. I've done a bunch of things in my life over, you can just see, I'm not going to reread the slide, but I've done a bunch of things in my life, but I think it's given me a really good, like, wide breadth of experience. And it's paid in and helps me understand, like, how to navigate, like, the unknown. So that's kind of my fun story.
Nice. All right, so growing up in Michigan, it's a land of automobiles, and I am still crazy about cars and bicycles and boats, planes, and horses, and anything I can ride, pretty much. And so I always knew actually that I was going to work on like special vehicle developments and like Corvettes or cool things like that. Just knew it. After getting out of undergrad, I worked at an automotive factory that made like all the interior mirrors, probably in every single car that's here that you guys have. Probably came from this one factory, believe it or not, the rear view mirror. And there I was like, wow, I don't want to be an automotive engineer. And I was really always driven by it came to realize in that time period that I was driven to be working on projects that actually make an impact. I didn't know what that meant. So I went to grad school at the University of Michigan, and while I was there, I started meeting a lot of people who were students and a alumni who are going abroad and coming back and working on emerging technologies that benefit people. And I'm like, that's where it's at. And actually, that's the first place I learned about people trying to control postpartum hemorrhage, was some young women engineers brought back from Ghana some mentally scarring videos of people trying to help women who are postpartum hemorrhage with basically no tools, which is we connected here later. So I only work in, I made it a rule, I only work as like my full-time job in companies that I believe that the product makes an impact. And you guys can do this too. There's plenty of people out there who can do the other jobs. Don't worry. You can just be selective. It's okay. And I've been in all these different startups working on life science tools, mostly stuff with cell analysis and things like that. Also compact CAT scanners and interesting things. So I was always the first person that they hired at all these startups. And I just decided I was done with that. And my wife and I saved up 12 months of money, runway. And we moved to San Luis Obispo very intentionally. We did lots of research. We traveled all over the world to look at sites that we were going to move to. Moved here with 12 months of funding, and it took 14 months before I had any pay. And so I started 2 startups here. One of them failed, and the other one we're talking about tonight. So here we go.
All right. Thanks, you two. Okay, I'll tell you all a little bit about Alydia Health. And then we'll dive into how we got to where we are, and then tell some fun stories about what it was actually like in the trenches. So Alydia Health and Impress Technologies at the time was really started with the mission of making childbirth safer for all mothers. And we really wanted to ensure that we were bringing to market a technology that would solve postpartum hemorrhage, not only for women here, but also for women all around the world. As we know, the burden of mortality as well as morbidity is much larger in low-income countries, low and middle-income countries. And so our mission and our vision from the beginning was to really make sure that we built a company that could make investors money, but also was going to be appropriate and affordable for the people that needed it the most. So what is postpartum hemorrhage? Really simply defined, it's excessive bleeding following childbirth. Most of the time that this is caused, normally when you think about hemorrhage, you think of some sort of major laceration or major trauma. But in this case, it's actually typically caused by muscle fatigue. After a woman has spent hours giving birth, the uterus itself, it can become extremely tired. And after birth, what's supposed to happen is the uterus is supposed to contract down to its correct postpartum size. And if this doesn't happen, you get hemorrhage. And the reason is because of how the muscle is vascularized. And really simply, the muscle of the uterus is vascularized in such a way that the blood or the muscle fibers and the blood vessels run perpendicularly like a basket weave. And if those muscle fibers don't contract, then the blood vessels remain open and dilated and just flow with blood. So it's a kind of a different way than you'd normally think of hemorrhage, but that's the underlying cause. So what this is called uterine atony. And so our technology specifically treats uterine atony. So how does it do that? It's a really simple device. It's 100% medical grade silicone. And Nathan, do you have one handy? Passing it around. Cool. So the way it works is that it's inserted into the uterus. And then this balloon is filled to create a sealed cavity within the uterus. And then a light vacuum force is applied to collapse the uterus onto itself. And it's that collapse that stops the hemorrhage. Real quickly here, I'll show you a quick animation. It's probably easier to see. So this balloon is filled with sterile saline, which creates that sealed cavity. And then vacuum force is applied to there's holes on the inside of that loop in the uterus, and that collapses the uterus down. It remains in place for an hour to 3 hours, I believe, on average. And then after that, the uterus is able to maintain its correct shape, regain its tone, and not be hemorrhaging anymore. So one of the amazing things about this technology is that what we learned in our first clinical study is that it only took 2 to 3 minutes to actually stop all blood flow, which is much, much faster than any other solutions on the market, and any other solutions in general. So this is really great in a less invasive way of treating hemorrhage than most of the other options as well. Cool. So that's a little bit about postpartum hemorrhage, our technology. But how did we get here? Well, it was really one step at a time. We definitely didn't have fancy animations all the way back in 2011. So I'll run through this, and you guys feel free to, of course, ask questions once we get into it. But here's a quick overview of how we started and how we got to where we are today. So we founded Impress Technologies in the summer of 2011. Actually, in the first Hot House Accelerator, it was a pilot program at the time that summer. And for the next 2 years, Nathan and I basically moonlighted. We had full-time jobs, and we're also working on Impress on the side. And Amy, we met Amy during that time, and she was doing some free work for us, which was great. And then in June of 2013, we were accepted into the Fogarty Institute in Mountain View. And that enabled us, along with some of our first funding, first checks, enabled us to go full time. And I moved up to the Bay Area, and we really hit the ground running at that point. Over the course of the next couple of years, we raised about $4 million on seed and Series A rounds, and that enabled us to do our first in-women clinical study, which Amy went and set up in Indonesia and was there for quite a few of the cases. And that was one of the most amazing parts, I think, of this whole journey, to get a WhatsApp message from Amy saying it worked the first time. It was pretty amazing. The next kind of phase after we knew that the technology worked was 2017 to 2020. We ran this massive clinical trial. It was a really tough one. If you want to pick an area to do a clinical study in, emergent postpartum cases, I don't suggest it. It's tough. But we're really glad we did it, and it took a while, but here we are. So we did that study. We ran some cases in Uganda, as well as a majority in the United States. And in the middle of 2018, raised a Series B round from the Global Health Investment Fund, which was a fantastic partner for us, because they really believed in and saw our mission of wanting to be able to provide a return to investors, but also wanting to ensure that our technology was affordable and accessible in low and middle income countries. They were a fantastic partner for us and really helped cement that mission and that vision for our business model. And then, just skip 2 years ahead, more work, but the clinical study was going on through this time, raised another big round of money. But in September of 2020, we received FDA clearance, which is absolutely amazing. The device is being used all over the United States today, which is awesome. And in June of this year, the company was acquired by Merck on behalf of Organon for $240 million, which is not too shabby. So that is kind of our really high level, this is how we got here. I think more interesting stuff is what's up next. Amy, do you want to take us into a little bit of daily life at Impress?
Yeah, sure. Okay, daily life. So I just put pictures because I felt better than words. So daily life was really interesting. It did start on a folding card table in a condemned building, and that was pretty cool. We got most of our design development done then, like
The first couple of years.
in that first year even. Yeah, on that table with duct tape all over it, which was pretty cool to know you can actually go really far in development as far as idea going and brainstorming on very minimal cost. As we started to get funded, you can see the upper left photo is one of the early renditions of the thought, using vacuum, using a balloon, some sort of combination of the two. And then we did a lot of more studying to try to figure out, well, what do we need to do? On the bottom left, the device sitting in kind of crushed silken tofu. A lot, it sounds funny, but you try to figure out, like, where can we get blood products? And early on, we couldn't find any. But we would ask OB-GYNs, what are we dealing with? Like, what's in the uterus? What does this have to be able to manage? It's not just plain blood. There's like remaining products of conception and just like bits of tissue and whatever. So they're like, yeah, it's like really pulpy orange juice or like silken tofu, really crushed. And like, okay, so we got a lot of really pulpy orange juice and silken tofu. We were like, let's see what we can suck up with this thing.
Remember, we asked Becky to put her hand in there and feel this. Is this what it feels like? And she was like, yeah. And we're like, all right.
This is all the 3 orange juice bottles in one. Oh my god. So, and then we did end up figuring out, like, oh, we can find some clotted blood. Actually, we just have to be clever about where to find it in town. There's an ag department here, you guys. So we were like, hey, call us. So that was really cool. So that's the upper right photo. We are actually trying to not put a really graphic one, but we are actually dealing with clotted pig's blood in that picture. So it's just, it was definitely a little crazy every day. We just figure out, like, what's our problem we're trying to tackle today and how are we going to do it? And it was something different every day or every week or sometimes halfway through. And I think half of it was just our day-to-day was just trying to always have like good spirits. We worked really hard, but we also made sure to play pretty hard. So you see we have our office dogs.
We had 3 dogs, basically.
3 dogs.
Office all the time.
Yep. Nathan's children were always there, which was kind of fun. And we would like race scooters around the office. When we were in the hothouse, it was a condemned building. When the neighbors moved out, we just cut a hole in the wall and took over their office. And we were like, it's always been like this. So we didn't tell them that. But anyway, they figured it out, I think. They hung a chandelier up. You get the idea. So it's just like, it was really important. You are always working hard. And if you just go from the investor side, they're like, I want to see results. I want to see results. But from the actual day-to-day side, it's not sustainable to work that hard and not actually take a break or celebrate the little wins, because there's so many little wins, but you're always moving the goalposts. So it was a good thing to remember. And Nathan was really good at remembering, like, we had a first aid box that always had chocolate in it. It was just a really like, this is really important. There was always something fun.
It's like a budget item.
It was a budget item.
Yeah, it's just like, we always had a dark, this ready.
So that was kind of some of our day-to-day. Like, sometimes it was this cool research development side of like hands-on work. Sometimes the day-to-day was the really boring documentation stuff, which we'll get into next. But a necessary evil, and I just say evil as far as like kind of sad to my soul, but it is really necessary because it's what we ended up sending into the FDA. So you can go to the next slide, actually.
Oh, that's Jessie.
Yeah. Actually, we were going to jump to clinical trials. Sorry. So this
If you want to talk a little bit about that boring stuff on this slide, go for it.
I think it's on the next slide though. So
That's okay.
that's okay. I'll go to the clinical trials. So there's some pictures from some of our clinical trials. I realize I can't find my Indonesia photos. So upper right is something we learned early on was, so our device is really meant, we designed it and we were like, it has to be used by a doctor. We wanted to be nurses and midwives to be able to use it, but for the FDA, the like conservative side of it, they're like doctors only. But if you've been in any hospitals or any, like, going and immersing yourself in that environment, it became very apparent. Doctors don't do anything without all the support of the nurses. So we would do all the doctor training and document that and everything, but then I would always make sure to bring like extra donuts or extra cookies, just something to be like, I'm going to feed you guys a little. If you're way overworked, let me show you how this works. So if you see your patient starting to bleed, call your doctor. Like, this is the power you have. So we really tried to empower all of the staff, especially the nurses, because they're the ones that have most of that contact time with our patients. And so that was like really important to learn in that. So I would do these little demos of showing them how it works, and everyone really liked it. And it was, this was just one of them. And then on the bottom picture,
In Uganda.
yep.
And that's a hospital that we really enjoyed working with. And all of those ladies and Dr. Mazzano there are great people who helped us. Actually, that's where we launched our first part of our clinical trial. We got it going there quicker. It was a wonderful hospital, but and well-resourced for the area, but really under-resourced compared to ours. But again, the nurses did most everything. They just had a few doctors, and yeah, food and stuff is always good. One of those ladies is the one who drew that hilarious thing up there on their whiteboard. Like, hey, if there's a problem, you gotta call Sarah. And Sarah, who is actually Sarah Del Ribo, who teaches an engineering class here on maternal health. She worked for us, and she went to Uganda and got it going. So she lived on the hospital grounds and like had her phone number. They would just call her any time of the day. In fact, Jessie and I went and visited her once, and we couldn't keep up with her pace. Like, she was just flying all over the place all the time. We actually said, like, you need to like take a break. And she was just like, oh, we gotta go check on the ladies. Oh, come back, go. It was crazy, but it was fun and intense.
Nathan, you want to talk a little bit about our work with Merck for Mothers? Oh
yeah, sure. So early on, we slipped. Early on, we really wanted to meet with Merck for Mothers. Merck for Mothers is an organization that does a lot of stuff with maternal health. But we were just these little people with a tiny little company and an idea and a dream and not much else. And we're wondering how we can meet with them. And so we tried to figure out how to meet with them, and they didn't respond to our emails or anything as you'd expect. But then we got some contact, and we said, hey, we're going to be in New York, where they're located, on some date that we kind of made up. And they're like, can we meet up with you guys? And they were like, oh, you're going to be here. Yeah, well, if you're going to be here, okay, yeah, we'll meet up.
Quick, book flights.
Book flights. There's no other reason to be there, okay? It just was a ploy that works, whatever it takes. And we got there, and they gave us more reception than we expected. And we talked about our device and what we hope to do with it. And we were really passionate about the impact that we were going to make with the device around the world, mothers everywhere, and especially around the world. And they were moved by that more than we realized. And they wanted to get involved with us. And the first way that they thought to get involved with us is we wrote a grant with them to send Amy and Brenda actually to India.
Yep.
And using their connections with the top OGN of the area, basically, they sent.
I felt like she delivered everyone's baby.
Yeah.
Everywhere I went, Dr. Keitha, you delivered my baby. It didn't matter what city we were in. I was like, who are you?
Yeah, no, that's right. And we learned a lot. We confirmed a lot of what we thought what the user device requirements were, especially for low resource places. But talking with Merck for Mothers, they were still like, oh, we really want to look at sub-Saharan Africa too. These are the two areas we're really interested in. So we did another grant with them, and they sent us to all across sub-Saharan Africa. Went from Liberia to Kenya and Uganda. I went to Uganda a whole bunch of times now, and I really fell in love with going to Uganda from all these trips. And this is some of the pictures of that trip. What I think is an interesting story about you can see Jessie up there presenting it. But this right here, Jessie, Brenda, and I are in Uganda at a birthing center. It's all midwives. They don't even have doctors there, and we're looking really concerned, not just because it's hot and we have all these people talking to us, because there's actually a mother hemorrhaging right now while we're having this talk. And we have what we believe is a solution, but it's not clear. We're not in a clinical trial or anything, and there's really nothing we can do about it, right? And luckily she's okay, but it's really like, this is why we're here, happening right there in a place where they don't have blood just waiting for a person who's lost blood. So it was really moving and empowering for us to go to these places and see how our devices are going to make a big difference, and see what we need to do to make sure it made a big difference. We could talk on for that for hours, but I don't think we have hours. So,
Nathan, we want to talk about our exit and wrap up.
Yep. Okay. So one thing is really cool, and that's why a good connection with the segue. So we secretly went over to Merck, right? And secretly, I mean, like, nobody in our investor circle, or not nobody, but the investors at large didn't want us fooling around with this kind of impact work. And so we went there, right? And we got this relationship with Merck, and they're the ones who helped make the connection to subsequent funding that we had, the industrial and institutional funding. So no small deal, actually, of that seed that we planted. Well, what was really awesome is they were watching the entire time. And when the company basically came up for sale, that little seed we planted, they outbid the other companies to take us. So it was pretty awesome. And the reason it's really awesome for us, not just that, is because their plans are, yep, we're going to keep what now is Alydia Health in the US to serve the developed nations. And then we are going to, with the company that they formed, we are going to address all the emerging markets. And so it's a continuation of our dream the entire time. We're really motivated to make an impact in the emerging markets. And this exit, I would say the number one thing to celebrate of this exit was not the return to our investors. That's great. That's number two. But it was the number one thing was that our mission was going to be continued to be carried out in terms of impact. So it was really good, really good news for us, and it was a great closure. And by this time, it had been many, many years, and we were all really, really exhausted, emotionally, physically. Everybody's really exhausted, and so to have it kind of like just close and put a little bow on it and be like, it's done. It was really great. Yeah, it was a really great way to end the long marathon of work. So yeah, I think is that it, Jessie?
Yeah, that's it.
Have questions anytime, feel free to raise your hand. I'm going to ask a couple questions. You can go right now.
I was just curious, you said in terms of active parents,
Jessie Becker.
Is that still true? Or can like midwives and nurses and all those people
I think we did expand indication.
Can you repeat the question? In case
Yeah, the question was can doctors still be are doctors still the only ones who can use it, or has it been expanded to nurses and midwives? And I can't answer with 100% confidence, but I know that our indications for use that we had initially pitched, the FDA expanded them because we had such good results, and it was deemed to be so easy in our human factors engineering qualification. So I think that nurses can use it, but midwives, but I don't know. I'm guessing it's hospital policy, so I'm not totally sure, but I'm pretty sure. I know they expanded the indication, so that was exciting. Yeah.
What was the most important lesson from this process?
I think we probably have a good answer. Okay, so the question is, what is the most important lesson from this whole process? And I bet we all have an important lesson, but let's start with Jessie.
Okay. Let's see. I think for me personally, there's two things that I think are really important. And the first is really knowing why you're getting into starting something in the first place. We started this because we wanted to save women's lives, and we wanted to save women's lives around the world. And being true to that mission and keeping that, I call it a North Star, in mind while you're building the company and while you're making decisions is really so important. And I would say the second big learning for me actually is that, I feel like entrepreneurs talk all the time about how you have to trust your gut, trust your gut. And you do, and I have always trusted my gut, but at the same time, it's not always easy to act on that. So recognizing that when your gut's saying something's not quite right, or I think we should be doing something slightly differently, and then really sitting with that and figuring out how to act on it is actually the most important part.
100%. That would actually be the biggest one. I think as an engineer, especially, what happens is you're presented an option, and you holding an option, you're like, this doesn't feel right. But then as an engineer, I go, but it has all the qualifications, and it's the right color, and you end up convincing yourself that's the right thing to do. And then and I think I would almost dare say 100% of the time when it didn't feel right, and we went against what didn't feel right because we convinced ourselves it was the right thing to do, it wasn't right. And it set us back.
like that's asking like favorite flavor of ice cream, which isn't fair. So I'm gonna do top 3, which Jessie and Nathan covered the first 2. It's like knowing your why is so important. Like definitely, like trusting your gut, super important, but knowing your why was massively important. And something like this, it is a marathon, and it's really hard. And there's great, awesome times, and then we show really fun pictures. And there's also days where like I cried in our first ISO audit, not in it. I had to go to the bathroom, but I really stood in there and cried for a minute. I'm not. But there were like crummy days, and understanding your why and understanding like this is why we're doing this. And then especially after being in Indonesia and seeing this woman who we saved her life, like this device saved her life. I had never seen, I'd heard about like hemorrhage before, but I'd never seen it until then. They had no extra blood for her. They were going to do a hysterectomy, and they're like, she would have died in surgery. There was nothing we could do. And she had to stay in the hospital for a whole week to get blood products because it was during Ramadan and there was no blood in the blood banks. So it was a really, really big deal that we, even if nothing else, I was like, all this work has we know it saved at least this one woman's life. And that was, it like got through like, you don't need those memories on like great days and you're like, I'm loving what I'm doing. Look at these dogs and look at this cool stuff we're making. But you need those days when you are exhausted and you're fatigued and things aren't going well and your investors are yelling at you and whatever. And you're like, why are we doing this? And you're like, oh, right, that's why. So that was really big. And then my third thing that I'm going to add, my midship flavor, is that I really think the human connection, human component is so important. You deal with, especially a medical device, like you have to understand your patient and who they are, but sometimes, or your customer, I should say. And your customer, like for us, our customers are not just the patients who are getting our customers, are the physicians and they're the nurses, and they're understanding like we're empowering these people to be able to treat a situation that they haven't been able to treat. That most of the time pregnancy goes super great and everything is wonderful until it isn't. And then it goes from this great, wonderful experience to an emergency, and they don't always know how to deal with it or what to do about it or how to deal with it. And they are throwing everything they have at it, and it's traumatic. It's traumatic for healthcare workers. And so understanding that and being able to show them like, we're here and we want to hear your input, but we also really want to empower you to be able to treat your patients. That's why we want to empower the nurses to call their doctors. I'm like, maybe can't use this during this trial, but you can get the ball rolling to get it going. You can help be empowered to like treat your patients. So that's my third one. That human connection is really important. I ended up doing a lot of the training for the clinical trial, not because like I'm a fabulous public speaker, you guys have all figured out by now I'm not, but the knowing your why was really important. Like they're like, why are you so much better at training versus these salespeople? Like, because they know what they're selling. I know why we're selling it. I know why this matters. And that's what you needed to bring every day with your why. So
what role did you guys assume in the beginning? What did each of you bring to the table? And how important was team chemistry in your guys' success?
I brought free coffee and baked goods.
Oh my God. Totally true. If I can just say about the chemistry thing, I think one of the things that we don't talk about enough, it was sprinkled throughout our whole presentation, but we all loved working together, even when we hated working together. And we all really respected one another and respected that we were all in it for the right reasons. And that level of trust was incredible. And on top of that, one of Nathan's superpowers is making things fun and making us stop and celebrate things. And that was so incredibly important. That's not in my skill set. My skill set's like, okay, check, what's the next, right? And so Nathan and Amy brings fun wherever she goes. So really that culture and that relationship that we all had and still have was so important to get us through the tough stuff as well. It wasn't just the why, like that hard why. It was also, we made things fun even when they weren't. But to answer your question about roles, early on, like I was the co-founder and CEO until we hired a CEO in 2016. And then my role kind of became whatever needed to be done. So still very entrepreneurial. And Nathan, do you two want to answer?
So you can do it.
You're doing a great job.
Great job.
Okay. It's like weird not being next to you. Okay. Nathan was our CTO and Amy, our first employee and lead engineer. And Amy also did a gazillion other things as well that don't typically fall under the title of lead engineer.
Just out of curiosity, how different did the first prototype look compared to what's on the market today?
Well,
That picture showed it.
the picture showed it, like the early Cal Poly,
Oh, that's even older.
that's even older, like the one with the 2 loops, and blue balloon. But I would actually say, yeah, we made that one. That would be nice to play. Yeah, exactly. I would say that our first one we got of our first like prototype from the manufacturer, almost identical to the one that's being sold today.
Yeah.
We really did a lot on that card table.
We did a lot because we didn't have the resources to turn lots of cycles.
Yeah.
So it's kind of like a rocket mission, right? They're going to send a rocket up to space, whatever, and they only have enough resources to put this one rocket in orbit. So better be right. And we tried everything we could to model every way we could and adapt. And when we finally were able to turn some real tooling, it cost us real money, like real money. That's the first thing that costs, like real money. Like, oh man, tens of thousands of dollars we're outlaying. I can't believe we could do it for that cheap, actually.
Yeah.
But we did because they helped us out. And we made this like actual like molded silicon product, and it was very similar to what you're seeing today that was being passed around.
Yeah.
So that it's kind of amazing to realize that we have this solution that could save some lives. I think 2014.
Yeah.
2013.
2014.
2014
Yeah,
sounds right.
2014. Indonesia.
Yeah.
What were the biggest unknowns going into that? How confident were you that your solution would actually work?
For the trial?
Yeah.
We weren't that confident.
Well, in theory, we were like, this should totally work.
That's what we've been telling everybody.
That's what we've been telling everyone, and I think that's what we all believe.
Yeah.
But then every once in a while, there were so many times where we talked to doctors, and like, this is our idea. And they're like, that's never gonna work.
Right.
And we're like, no, it will. Like basic common sense says it should. And like, no, it would have been done already if it
That's
could
right.
work. And so we really had to talk to them and at them to finally be like, come on, don't you see how like basic physics says it should work? My favorite analogy was like, we're closing all the blood vessels. And they're like, what? I tell them that's milkshake analogy. Anyway, I just felt like it's like when you've had those Wendy Frosties that are really thick and you go to like use their crappy straw and they're like the whole straw collapses. You're like, this is a crappy straw. But that's what we do to all the blood vessels is we crappy straw collapse them with just enough pressure and it works. And then we like tamponade, we do all this, like it has a couple of mechanisms of action, but that's something that we just saw even in our like pre studies that like that mechanism works to help stop bleeding. So I think I felt really confident, but there were just enough the naysayers. I was like, ooh, I hope so. Like that would be really awkward to make something go wrong. But luckily it worked in like immediately, like seeing the look on the doctor's face when he put it in and turned it on, I was just like, oh my gosh, it worked. And he's like, come here, feel this. Like, I don't think I'm allowed to. Okay, we don't have that opportunity yet.
I think we first thought it was going to take hours.
Yeah.
We didn't know it was going to take seconds.
Our data sheet was even wrong. We don't even track it for like 20 minutes was our first data
Yeah, we
point.
didn't know.
Not like 20 seconds.
Yeah, and it was much later where I got to see it be used for the first time too, and it was just chilling actually. Just like, oh my gosh, this woman's hemorrhaging out, and they used her device in it. It worked really fast. It was like, whoa! It just went from like the building's on fire, everything's fine, just like that, just
Want
like.
a cup of tea?
Yeah, just everybody, and then you can, if you're in a birthing center, like this was an OR that I had it, and that everything's super tense, and everyone's like, cool. It's all like, you just feel the energy, just like, everything's good, and you're just like, oh, how did that happen? And so fast. So I think the biggest thing we were wrong about is how fast it. We didn't know how fast it was.
We were pretty sure it was gonna work, but not that well.
So going back to kind of like the beginning of your presentation when you're talking about how it works, I noticed that you guys make it seem really simple.
It is.
Like, did you what was the process to get it to a point where you could explain it in like 10 seconds so somebody just understands it? Or was that how it always was?
The milkshake analogy is my favorite, but no one likes that. Like, wait, hold on, what's in that milkshake?
Yeah, I would just say years of practice. I mean, and real practice, not just like practicing to yourself, but testing out explanations on people. And what would happen is, like, over time, you'd give an explanation of how it works, and then you would pick up on the fact that that this phrase really got someone to get it, right? So you just like, and then little bit by bit, you're picking up on these little phrases, and you're figuring out what's the most important thing for someone to understand in order to get the whole concept, and stripping everything else away. So it's just an iterative process that takes a lot of time. Yeah.
Yes.
Yeah, so thank you both for being here. I am labor and delivery nurse for 10 years. So I do have a couple of questions. The Bakri, tomato, would that be your biggest competitor? And did you see a problem with that in saving, using for postpartum hemorrhage? Would a doctor still use the Bakri balloon and then use your device?
We hope not. So, I mean, I don't have a stake anymore. I only have a stake in for the perspective of the impact. So Bakri balloon is the standard of care, part of the standard of care. Our real competition is the standard of care, and the standard of care includes all sorts of things, including maybe hysterectomy and other things.
Yeah.
So we're competing against that. The Bakri balloon, it's only so here's the concept for everybody else what's going on. This uterus is flaccid, it's called, it's like a limp muscle and is bleeding. And so one thought is like, oh, if you have a cut, let's put something on it to cover it up, right? So inflate a balloon with fluid in the uterus and put pressure on the cut. That's the idea. So the same kind of thing. It's trying to put pressure on the cut, and it also hopefully triggers the uterus to have contractions again. So there's a couple multi steps. And so does a Bakri balloon work better than nothing? Yes. But it doesn't help the uterus get to its contracted state fast enough, in my viewpoint. And so the beautiful thing about this little device is that it gets the uterus down to the state it's supposed to be in, and the Bakri balloon keeps it distended. Thank you. So but the Bakri balloon, I mean, if you don't have anything else, right? But I thought about this too, like lots of times, like this is a great little device, but I think you could make this if you didn't have it. I think you could make it with some pieces, even pieces of a Bakri balloon, and add suction into that uterus and get that thing to collapse, which is really nice to do.
And then one more question, because you talk a
We
lot
made
about.
this for you, so you have the floor.
Yes. Okay. So you talk a lot about childbirth. How young or what gestation of uterus can this be placed in?
It just has to be big enough to get this, or part of this even, because this balloon, like we say to put it at the top of the vaginal canal against the cervix, but it could be further down. So if it was like an early, second trimester miscarry, it could be used then too.
We're not even sure that the balloon is really necessary.
Yeah, we have to do that for other reasons, but not good ones. So.
But by the way, full disclosure, you should consult the training manual. not us. Yes.
Seeing that deal, what are your next steps as entrepreneurs?
Well, I think Jessie and I are in a different state, but I would say the most interesting one to talk about would be, like, Jessie and I are working in places that we're just utilizing our skill set, and people are really happy to have all the experience that we had and like helping other people do stuff. Jessie's helping, she speaks for her, but she's helping entrepreneurs at Sac State, and I'm a director of engineering at a biotech company in Santa Barbara, working on blood cell analyzing tools again. But I think Amy is doing something more interesting if you want to share.
Sure. I am doing consulting to women's health to help keep clinical trials going. That pays my rent. But I also just started a company, so with another person to make a medical device to treat preterm labor due to cervical shortening. So in that, I've just been in the maternal health field for long enough that I didn't come up with this idea, but someone came to me with it and they were like, I heard you know how to do this field. And I was like, yeah, let's do this. And this makes sense. So it was really cool. So oddly, you know, even when you feel like, I don't know what I'm doing, I'm the expert in the field now suddenly. So just know that actually, because we're the experts. But it is actually, you learn a lot. But I was with Impress for 7 years. Like some days I felt so like I didn't know what I was doing. But then when I think about all the stuff we've accomplished in 7 years, that's actually a ton of information and a ton of knowledge. And I do know a lot. And I know a lot about from the beginning, like watching Nathan and Jessie go through in fundraising and all of the business side of it. I didn't have to do much of that. I got to just come and do the fun stuff. But I then had to do a lot of like quality management and FDA stuff and the verification validation. And like I just had to, we all had to put on so many hats that suddenly I realized I do know how to do this now. So that's what I'm doing now is I'm starting this company.
Yeah, awesome.
Yeah.
Save some more lives.
Just to be respectful of everyone's time, I've got one last question. How much room do you guys feel there is for new entrants to the medtech space? And what advice do you have for young entrepreneurs like us considering about going into it?
I'm
Oh
ready.
my gosh. Okay, so let me tell, like everybody always says, I think all of us would say this. Okay, the maternal health space is just a big wide open playground. There is, you would think that, okay, all of us were born. So we were born from mothers, and through that process, that is one of the least studied, least supported, least invested in areas of medicine ever. It's actually insane when we're in the process of it and realizing that like a lot of techniques and things that are used are super antique, and the reasons for their use aren't necessarily for scientific or valid reasons. And there's just not, I mean, like it's such a, what's really cool about this though, is that now femtech is a thing.
Yeah.
It was not a thing for us. It's
Yeah.
now a thing, and success stories like Impress are making investors go, oh wow, yeah, I want to get involved with this. So I think now, like in Amy, as she's starting a company in this world again, she's going to have a lot better time doing it. But that whole space in especially for maternal health is just wide open. Like literally everybody here could start some companies in it and probably find a lot of traction because there's so many different fields. That's one of the really cool plug for Sarah Del Rico's class is she takes the students and engineers through that and exposes them to a lot of the challenges that there are out there.
You guys work with me.
There you go.
Thank you.
That's what it is.
Awesome. Well, I think that concludes tonight's formal meeting. These founders are going to stick around if you guys have remaining questions. But I think that's all for tonight. Thank you guys for being here as always.